Hello everyone, I'm excited to welcome you to the first episode of Health Checks with Dr. Memstic. And today we are going to be bringing to you a very interesting topic. On the 4th of February 2025, we celebrated the World Cancer Day. And in line with the cancer awareness to ensure that people are aware about cancer and what they can do to stay healthy, prevent cancer, and get themselves screened early, we'll be focusing on the male gender. Guys, we're here for you. We'll be talking about the prostate cancer. I guess you have heard of prostate cancer before. Prostate cancer is the commonest cancer in the male gender. There are many things, like we all know, what is cancer? Cancer just means that it's a disease that affects any part of the body. You can have cancer of your eyes, your legs, your organs, your liver, your lungs, it affects any part of the body. Cancer just means that the cells of that part of the body grows rapidly, becomes abnormal, and grows in an uncontrollable way, so that it may spread to affect nearby tissues, organs, etc. So the cells, so now talking about prostate cancer. Prostate is a gland in the male reproductive organ. It's just beneath your bladder, and you have your urethra that carries the urine out of it. So this gland has a special function in the body. What it does is that it produces a fluid called prostatic fluid, and this fluid helps to enrich and nourish the semen. During ejaculation, this organ, this gland, contracts and causes semen to flow. So as men increase in age, there's a likelihood to have diseases of the prostate. And as with every cancer, there are modifiable and non-modifiable risk factors. When I say non-modifiable risk factors, what I mean is that these are factors that you have no control over. And one of those non-modifiable risk factors that puts men at risk of prostate cancer is the gender. Being a male puts you at risk of developing prostate cancer. Age is another non-modifiable risk factor. We have no control over our increase in age. In short, growing old is a blessing. So as you increase in age, your likelihood, your chances of developing prostate cancer increases as a man. Another non-modifiable risk factor is your race. By being Africa, by being black, you are more at risk than the Caucasian to develop prostate cancer. So those are the non-modifiable risk factors. You can't do anything about it. But we also have the modifiable risk factors. These factors are in your control. You have the ability. That is why we're bringing this awareness to you, so that you can modify your lifestyle, your eating habits, and ensure that you reduce your risk and your chances of developing prostate cancer as you increase in age. What are these modifiable risk factors? Number one I want to talk about is our diet. You need to eat a healthy diet. A healthy diet is required to support the function of this organ, prostate, and reduce your chances. You need to take away saturated fats, fatty foods from your meal. Eat a lot of fruits and vegetables. Particularly worthy of mention is tomato. Tomato contains an antioxidant called lycopene that protects the prostate gland, coming down with cancer. And they have a lot of vegetables like the cabbage, the cauliflower. Those are very helpful. They protect and help with the prostate functions. So you need to reduce also your carbohydrate intake, like every other form of cancer. Excess carbohydrate is not good for the body. It will make you gain weight and then predisposes you to having cancer of the prostate. So what are the things you should eat? You should do a lot of foods that are rich in fiber. Take a lot of oats. Take beans as your sources of food. Take everything in moderation and ensure you have vegetables and have fruits in your food. Don't forget, I have mentioned tomato. Ensure you take tomato raw or steamed. Ensure you eat tomato as a man. And then nuts are very important. An example of the nuts that protects against prostate of the cancer is the pumpkin seed. Ask for it. It is sold. It is available. It's rich in zinc, helps regulate the functions and reduces inflammation in the prostate gland. So you have to modify your lifestyle. Exercise, moderate exercise 3 to 5 times a week. 30 minutes of brisk walk is enough. And sedentary lifestyle. Yeah, you men are busy, office work, and moderate your activity in the office. Instead of sitting from morning to night on your chair, you could carry your laptop, stand, do what you want to do. If you're answering a phone call, it's better you pace around answering the calls. That helps you. It gives you some form of physical activity rather than just sitting down and being on the phone. So exercise, you must incorporate exercise to your daily routines to reduce your risk of having prostate cancer. Another thing you can do to reduce your risk of developing prostate cancer is to ensure that you quit smoking if you smoke. Every form of cigarette smoking predisposes and increases your chances of developing cancer, not just cancer of the lungs, even cancer of the prostate. So you have to plan and try to quit smoking. Alcohol should be taken in moderate consumption. Excessive alcohol consumption has been linked to the development of cancer. And then also some vitamin deficiencies. Some men have been shown to be deficient in vitamin D. So having an early morning sun exposure, just 10 minutes outside the sun, can help you, give you adequate vitamin D. And then if you don't have such luxury, you can do vitamin D supplements. So these are modifiable risk factors. Interestingly, else I forget, studies have shown, and studies are still ongoing, that the frequency of ejaculation reduces your chances of developing prostate cancer. What does that mean? Ensure that you have regular sexual activity, whether with a sexual partner or by masturbation. The frequency, one study said that if you ejaculate 5 times in a week, your chances of developing prostate cancer is reduced. I guess men will like that. So go out there and try to ensure you empty your tank, but also play safe and do it with the right partner. It reduces your chances of developing prostate cancer. So those are the risk factors for prostate cancer. Then how do we detect? Somebody may want to know, what are the signs and symptoms? How do I know that I'm at risk, or what I'm experiencing could be signs and symptoms of a prostate disease? Because it's not just prostate cancer. We also have the enlargement of the prostate gland. Watch out for the next episode. We'll be bringing to you the signs and the symptoms you should look out for as a man that predisposes or points to the fact that you have a prostate disease. It may not necessarily be prostate cancer. It may be the enlargement of the prostate gland, what we call benign prostatic hyperplasia, BPH, or maybe prostatitis. So in the next episode, we'll be talking about the signs and the symptoms and the screening tests you should do once you're over 40 to find out if you are at risk or if you're already developing a prostate disease. Once again, my name is Dr. M. Peters, and this is Health Checks with Dr. Memstic. Thank you.